everybody, I'm Martha Kennedy. I'm here today to talk to you about Neuro Checks. Neuro Checks are very important for our residents. This is something that you do if the resident has had a fall and hit their head, if the resident has fallen and they can't tell you whether or not they hit their head, or if you see a visible injury or their head hurts, you can do Neuro Checks. Now remember, our policy for Neuro Checks is going to be that you do them 4 times for 30 minutes, then 4 times for an hour, and then you're going to do them every 4 hours for 24 hours, and then every shift for 72 hours. Now you may do them longer depending on what the doctor says, okay? Now, let's say you've come upon a situation where you need to do Neuro Checks. PCC has something that will guide you, and it's called the Neural Evaluation. So you can see here, you'll click on the Neural Evaluation, and that will start the ball rolling. So anytime you do Neuro Checks, remember you can always get these things as you're going through the assessment. You need to know if they're alert to their self, if they were before. We're checking to make sure nothing's off, right? Person, place, and time, okay? And are they arousable? Are they awake? Are they alert? You're looking for signs of pain while you're going through the whole assessment. So, first thing you're going to do is always you're going to get your vital signs. That includes your temp, your pulse, your respiration, your oxygen saturations, okay? So we've got those done. Now I'm going to be talking to her. And I know this patient, obviously, and I'm going to say, how are you doing?
Good.
Yeah? What happened?
I fell going to the bathroom.
Trying to get her to talk to me a little bit. And I'm saying, does anything hurt?
My head does.
Your head does? Okay, how about anything else?
My left arm.
Tell me where it hurts.
Right here on this side.
Yeah, okay. I'm going to do a few little tests just to make sure everything's going on okay, all right?
Okay.
All right, so next I want to check her pupils, right? When you're checking the pupils, you want to use a flashlight. You can make the room a little darker, but you're checking that pupil to see if it contracts and expands as it should. Anytime you check the pupil, you want to come from the side with your light on, and you want to check the reaction. And then you do the other side. You can also make the room darker, a little bit darker, to make sure that it's going okay. All right? Then the next thing I want to do after that is mark it on here. They also have, if you show, they're going to ask me if they were equal, if they were reactive to light. You've heard of Perla. And then the size of the pupils, okay? Now, we're going to see, can she follow her finger with my eyes? Can she follow my finger with her eyes? Anytime you have someone follow you, you want to come out, and you want to start in the middle, and then you want to go out, okay? You see how she can follow? Very good. Don't forget to tell them what to do, but she was a true help there. So, she told me that she had some pain. Now I'm going to see if there's anything else. Remember, she said her arm hurt, so I'm going to see if her arms and leg are moving okay, if she's guarding or having any pain. All right, let's see your hand. All right. Can you move it? Very good. Does it hurt? Okay. She's following simple commands. That's a question. How about this one? Does it hurt?
At my elbow.
Yeah, so she's guarding a little bit, so I'm going to note that in my charting. Do I want to keep moving it? No. I'm going to say, okay, let's set it down. Let's see what else we got going on. How about here? Are you hurting? Okay. And here?
It's fine.
Okay, great. Again, we're going to go back over to our charting. She responded to simple commands. She told me what was appropriate. She verbalized that she did have some pain, and if you notice, she kind of guarded a little bit. So I know that's going on. I looked at both extremities, and then I'm going to make a little note. I'm going to make a little note on what's going on. Of course, I'm going to let the doctor know that she was having pain to her head, and she had pain to her arm. This is what I found. This is how it's going. Now, the next person that comes on can look at what I've done and compare it to them. What we're looking for is changes in the neurological function, right? Now, remember how we do those. We're going to do what? Just kidding. We're going to do Neuro Checks every 30 minutes for 4 hours. Then we're going to do them every hour for 4 hours. Then we're going to do them every 4 hours for 24 hours. And then we're going to do them every 8 hours for 72 hours or longer if needed. Any changes in these neuro checks should be immediately called to the doctor and let them know there's a change in condition. Thanks, guys. Bye-bye.